Welcome everybody to today's session on Privacy and Confidentiality, a guide for general practice. My name is Magali de Castro and I'm the clinical director here at HotDoc. And today's session came about because it's just one of those topics, one of those areas that we're constantly being asked questions about. And with the recent introduction of the Australian privacy principles, there was a bit of confusion and obviously a bit of anxiety that came along with, well, what should we or shouldn't we be doing around privacy and confidentiality. So hopefully today's session will help clear up some of those questions and hopefully reassure a lot of practices that it shouldn't be as scary. Obviously it's an important area, but it shouldn't be as scary as some people have made it out to be from at a practice level. So the one of the key things to remember is this session is being recorded. All our webinars are recorded, and the recording of it, along with all the handouts and any resources that I talk about, will become available next week, so usually a week after the live session. If you have any questions throughout the presentation, if you're attending live, you can just type them into your questions tab and we'll address them at the end. If you have any issues with your sound or your internet connection, don't stress. Again, it's being recorded, so you can always access the recording later on. All right, so let's get started. So in terms of what we'll be looking at today, we'll be looking at what are some of the key privacy and confidentiality considerations for general practice. We'll talk a little bit about what needs to be part of a policy and procedure if you're going to have, which you should have for your privacy and policy and procedure. So how to create a really robust and comprehensive one. We'll also have a bit of a chat about some of the best tools and resources to kind of support and train your team around these privacy principles. So the first thing is, what do we mean when we talk about privacy and confidentiality? Obviously, when we're referring to these terms, we're really talking about the fact that in general practice, we collect and use all the time, every day, sensitive information. So sensitive patient information that can be as basic as, the patient's name, date of birth, address, but obviously as sensitive as, health conditions, the progress notes, what's happening with the patient, diagnosis, test results. So you could actually say that most of the information that we collect in a GP setting is going to be sensitive information. What's the problem with that? The issue is that under the Privacy Act, anything that qualifies as sensitive information has more strict requirements. Now, there's also another little kind of tidbit that we can only really collect sensitive information with consent. This is not really a huge issue in general practice, because usually the information we're collecting is directly from the patient or their guardian. It's very rare that we would be collecting patient information without the patient essentially knowing about it. Obviously, the privacy principles apply to all organizations and all agencies within and outside health. So some of the principles that I'll mention are not as relevant to general practice, but it's still handy to kind of be aware of what they are, because again, it'll apply more to other industries. But obviously, we'll focus on the ones that apply to general practice. So in terms of how we manage information and privacy, our current legislation, the key thing is that obviously everything has to be in line with the relatively new Australian privacy principles, so APPs, which you'll see a little bit here and there, especially when you're putting together your privacy policies. And these came into effect in 2014, so not that long ago, which is why a lot of clinics are kind of like feeling like this is a new space for them. So I just want to touch on what these 13, so there's 13 APPs, or Australian Privacy Principles, and I just want to touch on what they are. And again, as I mentioned, these apply to all organizations and all agencies. So some of them are going to be more relevant to us in general practice, and those are the ones that obviously I'll spend more time discussing. So probably the most important one is Principle 1, which talks about open and transparent management of personal information. So what does this mean? This is probably the biggest change, and it's a good change in my opinion. The key about this is we usually, in general practice, privacy is one of those things that we all know it's important. We usually, if we're accredited, we'll have a policy around it, but a lot of the times it's something that most people wouldn't have really taken the time to read. Most staff members won't even know what's in that. Even some practice managers and owners may not even understand what's in that policy, that it may have been created, you know, in order to make sure that we have a policy and procedure manual, but there wasn't necessarily a lot of reflection or thought that went into that. So one of the key changes now with this principle 1 is that our privacy policy has to be really, really clear and in a language that's easily accessible, and also it's easy, and the way you keep it has to be easy to find or access for patients. So what this means is we need to really understand how we're dealing with privacy in our clinics so that we can put it onto our privacy policy in a clear and accessible way. So again, this is in language that your patients can understand, and obviously that your staff can understand. So even if, you know, if there's a question from a patient to, you know, one of your receptionists, they should be fairly comfortable in discussing that or answering some questions, and obviously referring to you know, the appropriate person if it's something that they can't immediately answer. But by and large, it should be clear, it should be accessible. This means we have to spend a little bit more time just reflecting and thinking about what we're putting into this policy. So what needs to be covered in this is what's essentially covered in some of the other principles of the privacy principles. So, well, principle 2 is anonymity and pseudonymity. So that's essentially around the fact that, you know, people have the right to use pseudonyms so that they're not identified. Obviously, this is not practical in a general practice setting, because we do need to be able to obviously identify patients for multiple reasons. One, for security reasons in terms of making sure that we're providing care to the right person, and another reason is obviously for Medicare, for claiming and all sorts of things. So this principle may not hugely apply to general practice, but it's just good to be aware of it. And again, it's because it's not really practical in terms of the work that we do. Principle 3 is around collection of solicited personal information, which again, the majority of the information that we collect is usually directly from the patient. So the patient is telling us this information, or, you know, it might be, say, a test result or a report from a specialist or something, which again, it would have been initiated with the patient. We're not really one of those agencies where, you know, we're going to be collecting information for people without people necessarily being aware that that's happening. So again, this is important to keep in mind, but it's not really a huge issue. Principle 4 is dealing with unsolicited personal information. This actually may affect us in general practice. An example of this is what's the policy or what's the process that you have in your practice if you receive, say, for example, a piece of correspondence, a letter, a test result for a person who's not actually a patient of your practice. So say, you know, the pathology company or somebody made a mistake and they sent it to you. This happens all the time with faxes. They sent it to your practice by mistake. You have to have a process, and again, make that part of your policy and procedure about, well, what do we do when we receive this information that we haven't asked for, we haven't solicited, and it's not for someone that we care for. So again, it should be a process that all staff is aware of, and, you know, it should be a standard thing. So what do we do? Do we do we archive it? Do we contact the source of that information to say that they've made a mistake? Do we destroy it? Yeah? So that's again something that you'd have to reflect at a practice level, what's going to be the best approach. The other thing is, with a lot of these areas, if you're unsure, one of the great people to contact is actually your professional indemnity insurance providers, because they can help you obviously from a medical legal point of view. What are the legal implications if we do one thing or another? Obviously, the reason why they're the best person is because they're the best agency, is because they're the ones who will be footing the bill essentially if your practice is sued, or in the event of a breach, or, you know, you're deemed to be liable. So if they gave you the advice, then it's kind of on them. But they usually can give you a lot more detailed advice from a practical example point of view. Yeah, so keep them in mind as well as a resource. There's Privacy Principle 5, which is notification of the collection of personal information, which again probably doesn't, as long as we're letting patients know at the points that we collect their information, this principle is probably not something that we need to worry too much about, because it's rare that we'd be collecting information for patients without them being aware of it. Yeah. Principle 6, use or disclosure of personal information. This is a big one. So as a clinic, especially now that we're using, most clinics are computerized, when we're using computerized systems, there's a lot of other agencies or services or other parties that have access to that data. For example, if you're using a clinical software, if you're using a cloud system, if you're doing things like online appointments, or if you're using a service for sending out SMSs or whatever it is, these are agencies, or for accreditation purposes, your surveyors, when they come in and have a look at your data, if you're providing information, uploading records to MyHealth, or uploading summaries, I should say, to MyHealth record. If you're transmitting immunizations to the immunization register, all of this is ways in which you're using your patient's information that they should be aware of or be made aware of. Again, not necessarily because they're going to be able to opt out of a lot of these things, but at least they know that this is part of them doing business with you or engaging with your service. Again, it doesn't have to be complicated, and the idea is that you would word it in such a way that, again, it makes it fairly clear that our practice uses these services in order to provide as part of our business services. Obviously, all the agencies that you'd be using, you would be wanting to make sure that they're compliant with the Australian privacy principles, particularly if they're in Australia. But again, it's just about letting patients know, so they're consenting essentially as part of having services with your clinic. They're consenting to the fact that this is the way their information is going to be handled. Principle 7 is around direct marketing. This is, again, another big area of confusion and stress, because this is where we start talking about where do patients need to opt in or opt out for things. And when we talk about direct marketing, we mean anything that is could be seen as a message, or for example, letters, or any kind of notification about something that's going to lead to a financial benefit for the practice. So this is not new. A lot of people feel that this is a new area, but this isn't new. And we've always had for example, the reminders. So the fact that, a clinic, if we run a reminder system, as in we notify patients when they're due for routine pap smears, when they're due for immunizations, when they might be due for health assessments or care plans or things like that, that is actually, or can be considered, direct marketing, yeah? Which is why, for the longest time, we've always said, even before these privacy principles came into effect, patients need to be made aware that they can opt out of your practice's reminder system, yeah? This doesn't mean your recalls for abnormal test results and things like that. Patients cannot opt out from being informed when there's an abnormal test result, and when the patient, or where the doctor needs to see them for some critical reason. They can't opt out of that, but they can opt out of any health promotion and kind of reminder type services. Again, this isn't new. We've had this as one of our accreditation indicators for the longest time. So the key thing around this is obviously making sure when patients either register and they become new patients, that your clinic uses a reminder system. This is how we'll send you reminders. You can opt out if you so choose. Most patients won't, but again, some will, and it is their right to be informed that they can and to act on that right. I will talk a little bit more about direct marketing again later in the presentation, just because it's a big area. Principle 8 is around cross-border disclosure of personal information. So what does this mean? This is if we're sending any information or any patient information overseas. For example, some clinics might have automatic backup services or cloud services that are actually hosted overseas. Or this doesn't tend to happen as much with general practice, but sometimes with specialist clinics, they'll use, the transcribing services, where the specialist might dictate the letter or the progress note entry and then send that recording overseas, and that then gets transcribed into text to go into the patient file. That is considered obviously an overseas, or sending information overseas. Again, it doesn't mean that it's not allowed. It just means that you have to be very clear and transparent with your patients that this is where their information is going to go. Again, it's probably not going to be an issue for probably over 80 or 90% of clinics, but if your practice does use any overseas services, you have to disclose this as part of your privacy policy. Principle 9 is around the adoption or use or disclosure of government identifiers. So things like Medicare numbers, the patient identifier for MyHealth record, things like this. Obviously, again, it's just to mention that we use we're going to be using these identifiers. We will keep them secure, obviously, as part of, you know, the way we look at all of their other data. But you have to let patients know that, you know, these indicators are going to be used at the clinic, and obviously that we will be connecting with some of these agencies to transfer information. With Medicare, we'll be sending Medicare, you know, claims and item numbers. My Health Record, we would be uploading shared summaries and things like that. Same with, you know, immunization register or any register. So again, it's just about making a mention so that patients are aware that these numbers are being used as part of our, you know, everyday business of looking after their health. Principle 10 looks at the quality of the personal information that you keep, which is essentially just around how do you make sure as a practice that the information that you have on patients is accurate and that it's current or up to date. Yeah. And obviously some of the very basic interventions or strategies that clinics will be using is routinely asking, when patients come into reception, routinely asking, what are your current details? Have any of your details changed? So, you know, if your phone number, your address, anything like that. Then principle 11 looks at the security of personal information. So obviously, because we have the privilege of being able to have access to this sensitive information, we also have the responsibility to look after it. Yeah. So how are we protecting that patient information? Obviously, do we have, you know, password protected systems, firewalls, antiviruses? If we're transmitting this, you know, messages or emails or anything with other providers or other services, is that transmission secure? Are we using encrypted messaging services instead of just an open email that could be intercepted by anybody, or it could be received by anybody if we type the email wrong by one letter? Yeah. So that's more around the security and how we look after that. You wouldn't have to go into full detail in your privacy policy, but again, you would have to allude to the fact that, you know, you are looking after the information in the best way that you possibly can. Principle 12 looks at access to personal information. What this means is the patients have the right to access their personal and clinical information. Obviously, because of the clinical nature of working in a GP clinic, you can, obviously this can be at the discretion of the GP, but if there is if the GP, for example, refuses to give access, there has to be a clear reason as to why, and it would usually have to relate to it presenting releasing this information, presenting a risk to the patient, so a safety risk to the patient, or, you know, or to others, essentially. So you can't just not let patients have access to their records just because you don't want to. That's not a good enough reason. Yeah. So you have to obviously explain as part of your privacy policy. There should be a bit of guidance as to how patients can request access to their personal information. And then principle 13 is correction of personal information. So how can patients correct or change or modify details that you're keeping if they're not in line with what's actual factual truth? Having said this, obviously, because of the clinical nature of the work that we do in general practice, you can, as an organization, refuse a correction if it's based on a clinical judgment from, you know, their treating doctor or whatever it is, and that then would have to be, you know, in writing and in quite a formal kind of process around it. But these are all rights and almost responsibilities, essentially, that we have to abide from a legal point of view. Okay. Now, I've talked about a lot of different things, saying that obviously the privacy policy, your privacy policy is the key thing. We actually are releasing a training module that will go specifically into how you look at developing your privacy policy. This module is going to be available from next week. So this is, again, from the time that this recording is available. This module will also be launched, and it's presented by June Hannon, who has a lot of experience, again, working with practice managers and working with clinics around, all things practice management, but in particular, obviously, around crafting a good, clear, and applicable privacy policy for your practice. So keep an eye out for this one. This is going to be available from next week, and again, it'll give you the practical how to if you need to address your privacy policy. So obviously, I've talked about a lot of different things, but in a nutshell, the key things that you want to keep in mind is to be mindful and to inform your patients in as clear way as possible about how you collect their personal information, how you use that information, how and how you might share this information, how you get rid of it, so how you dispose of this information once you no longer need it, how patients can access this information, and how they can access your privacy policy essentially easily, which again, this could either be available on reception, which is ideal, but also if you have a website, then it should definitely be available through your practice website. And you should also have a way of informing patients about the process of direct marketing, specifically around your reminder system, because that's usually the area where you will be doing direct, or what could be considered direct marketing. So what your process is. Again, most clinics will have it as a notification as part of the patient registration form that this clinic uses a reminder system to notify you of health promotion activities or other services that we think might be suitable to you. You can opt out of receiving these notifications, or you can choose not to be part of these notifications. It's a good idea to also, obviously, because not every patient is going to be a new patient, you can have this as part of, like, make a waiting room sign or something to let people know, again, inform them that this is something that you do and that people can opt out at any point if they wish. It's not just about, obviously, your privacy policy and the way that you train your staff. Another key thing when it comes to privacy is the actual physical layout of your practice. Yeah. So structurally, how are we making sure that we're protecting critical patient information? So one of the key things is, obviously, again, structurally, when we're looking at our practice, and it is worthwhile having a think back to our clinic and go, well, do we have good soundproofing between internal walls? If I'm sitting at reception or if I'm in the waiting room, I shouldn't be able to hear what's happening in the treatment room. I shouldn't be able to hear what's happening in a consulting room. And yeah, same. And definitely we shouldn't, in terms of, we need to have private areas so that we're not having private conversations in, say, hallways or places where you could have either any staff member walking past or any patient walking past and all of a sudden learning all the gory details of Mrs. Smith's treatment. Yeah. So good soundproofing between walls, good private areas for private conversations. When it comes to your computer screens in reception or in other areas, making sure they're hidden from the view of patients and visitors, making sure that you're using password protection and screen savers, again. Make sure that, this is a big one, and it's a difficult one, is making sure that private and confidential discussions in reception cannot be easily overheard. So many times you'll be sitting in a waiting room and you can hear the receptionist talking to a patient, and you can hear absolutely every single detail about what they're talking about. Logistically, obviously, sometimes practically, it can be difficult just because we don't tend to have huge spaces to work with. But again, it's one of those things that if you know you're going to have a particularly sensitive conversation, try not to have it in such a public and open space. Ideally, if you can separate or even almost like soundproof a bit the area where the receptionists are talking versus the area where the patients are sitting down and waiting, that's the best case scenario. If you can't, then making sure that if there's going to be a sensitive information, perhaps take that conversation to a different area, particularly if you've got nurses that might have to ring a patient and have a discussion with a patient over the phone. Ideally, take that to another room, maybe do it from a consulting room or another place. Yeah. The other thing that we see a lot of is, obviously, because we often struggle for space in general practice, you might have nurses who need to do care plans or health assessments, or even just assess the patient in any way, shape, or form, and the only space they have is the treatment room, and there's other people walking past the treatment room, and that's usually not an ideal scenario, again, because we are dealing with private and sensitive information, so you want to make sure that the patient also feels comfortable that not everybody who's in the waiting room or walking past is going to be able to hear everything that's happening. So if we look at, we've looked at a lot of different things, but if we look at realistically and practically at the moment in your practice, how are you approaching privacy? What are some of the key things that you're doing right now, which you would be doing, most clinics do, that are kind of helping, or that are kind of in the right direction in terms of privacy? The first thing is about obviously having that clear, transparent, and patient-friendly policy. If you don't even know where your policy is, that's a big red flag. So that's probably something that I'd be writing down of first thing we need to work on is having easily accessible privacy policy, to the point where I should be able to ask any reception staff, any nurse, any GP, where's our privacy policy? And they should be able to, at the drop of a hat, go, oh yeah, you can find it on reception, or you can find it on our website. Yeah. If you go, oh, I don't know, it's probably in one of the policy and procedure manuals up in, 3 rooms towards the back, up the stairs, and only the practice manager knows where that is, then that's not good enough. That's definitely an area to work in. And if it's easily accessible, but you try and read it and you go, I can't make any sense of this, keeping in mind that it should be at a reading level of around 14 years of age to easily understand, and even that's a bit far too high if you've got a lot of patients who have English as a second language. So again, how clear and transparent and kind of easily accessible is the wording of that policy. Yeah, first area to work on. That's probably going to be a lot of us, if not most of us, going, all right, I need to work on our privacy policy. The second thing is having a key staff member who is the person kind of dedicated to oversee privacy procedures. It's usually going to be the practice manager, but this is going to be the go-to person. Yeah, so if there's a privacy question, if there's someone that needs to be trained on, privacy and confidentiality, this is the kind of responsible staff member to either know the answer or know where to go and get the right answer. Then the next thing is going to be having a consistent approach to training your staff, on privacy and confidentiality. Usually we're going to start with, induction, so at orientation, making sure that we're all on the same page. Never assume that just because someone's worked at another, medical setting, that they're going to know everything there is to know about privacy and confidentiality. You still have a duty of care to train staff and make sure that they're on the same page with what your practice believes and does. Yeah? The other thing, which again, I would believe most clinics would have, but if you don't, it's a must. You have to have staff sign confidentiality agreements, privacy and confidentiality agreements, and make sure that you store these in your staff folders. This is something that usually accreditation surveyors are going to want to ask about, and they're going to want to see. So again, a lot of clinics that have gone through accreditation would have this already, but again, making sure that even that documentation or that, that agreement, that the language makes sense. It's not, legal jargon. It's something that you can read and go, oh, yeah, I understand what that means. Yeah. So speaking of accreditation, we do have several indicators when we're looking at accreditation that deal with privacy and confidentiality. And the majority of these are not new. I'm actually using the wording from the proposed 5th edition for the standards, which are being released in October 2017. So even though this is the wording that's going to be used in the 5th edition, it's most of these indicators are current, and they're still part of the 4th edition. So any clinic that's been accredited against the 4th edition should be meeting this criteria. So the first one is around the 3 approved patient identifiers. And the key with the 3 patient identifiers is that it's not just a one-off. This is something that we need to check every time a patient makes an appointment, every time the patient actually presents to the clinic to come in for their appointment, every time we're communicating with the patient, over the phone or electronically. If the patient rings and is asking for, any kind of information, or to arrange, a new referral or a repeat for a script or something like that, and anytime we're collecting or managing information, so for example, when we're scanning documents or, bringing in x-rays and things, these sort of things. So the more common 3 patient identifiers tend to be name, date of birth, and address. And I know it can be a bit of a pain, but if you get into a habit of asking them routinely and letting patients know why you're asking it routinely, because particularly patients that have been coming to a practice for 20 years go, what, don't you know me by now? Which we do know them. But the reason we ask is because we can often have multiple patients with either similar names or with the exact same name, and we want to make sure that we're always pulling up the correct file. So if we're making the appointment, that we're making the appointment for the right patient, that we're writing the notes in the right patient file, that we're ordering the blood test for the right patient, that we're writing the referrals, and all of this, that we're archiving things with the right patient. So if you kind of teach the patients to let them know that, yes, I have to ask you these things, but it's as it's a safety kind of mechanism to make sure that we, you know, to safeguard against that multiple patients having similar names, then yeah, usually they tend to be a little bit better with time. Some of the things that we've other indicators that, again, we've talked about, but this is where kind of we see them from a, yes, actually, when we're going through accreditation, they do check these things. One of them is around informing patients about how the practice manages confidentiality, which, again, that's just your privacy policy, yeah, having a clear, accessible privacy policy. Then making sure that the appropriate team members have the appropriate level of access to patient health records. So obviously, usually your GPs will have the highest level of access, and your receptionist might have the lowest level of access. So your receptionist might only have access to patient demographics, so enough to make appointments. So all the demographic details, but not necessarily clinical information. Then you might have your clinical staff, your nurses, your GPs, allied health. They'll have access, obviously, to all the clinical information, the notes, the results, and all of this. But they may not have access, particularly, say, the nurses and allied health. They may not have access to how to writing prescriptions and things like that. So then, obviously, your GPs would have full access to all of those things. So appropriate access for the different team members. Make sure that you're informing patients of how they can access their health information, which we've talked about before. Whenever, and this is inevitable in practices, whenever we need to transfer patient health information, so if we are sending a patient file to another clinic, or even if it's just bits and pieces of information, that this is done in a secure way, and that whenever we're transferring information, we have the consent of the patient to do so. So it shouldn't just be, oh, another clinic just called us saying they want this information and we send it. Well, no, we need to see evidence that the patient has consented to this transfer. Yeah, and usually that'll be in the form of written, signed kind of consent and transfer form that will come from the other practice, but that actually has the patient's signature as part of it. Again, we've talked about this, about protecting computer screens to make sure that the public, that's walking past is not able to easily see things, but it's important to know that these are actually accreditation standards. Those are things that kind of make sense, but we actually need to be able to meet this in order to stay accredited or become accredited. Individual passwords, which we talked about, so for different levels, different passwords, and try and avoid, so this is one of those big things that a lot of clinics do, try and avoid having one login and one password for multiple people. For example, we often see a nurse login, so it's just the one nurse login for all the nurses. That's not good practice at all. Why? Because we need to be able to have an audit trail of who's doing what, yeah? And we need to be able to, particularly with anything that's going into clinical notes, we need to be able to see, well, what clinician did what service, provided what service, and then for notes and all. So that's just opening up to a world of medical legal issues. Have individual access for your individual staff members so you can see clearly who did what, yeah? And again, if you're sending any information electronically, particularly usually to other providers, then make sure that this is done safely using encryption software, so it's not just an open email. Yeah. In terms of additional accreditation standards, how we store and destruct any records that are no longer viable, or that we're not going to be using. We have, obviously, that has to be addressed in our policy and procedure manual, but obviously making sure that our staff are aware of how we do that, so we don't have little whoopsies that can become really big legal whoopsies. Making sure that, obviously, only authorized people have access to things like prescription pads, letterhead, any admin records or any official documents. And a new indicator that's coming in is around having a practice policy for the use of email and social media if your practice is using email and social media. So this is a proposed new indicator for the 5th edition standards. Okay, so I said that I would talk a little bit more about direct marketing, particularly when it comes to electronic messages. So we have the Spam Act from 2003, regulates sending commercial electronic messages. So remember how I was talking about direct marketing, anything that's reminder related could be considered direct marketing. So we have to tread with caution, yeah? So specifically when we're talking about electronic messages, this includes any type of communication such as email, SMSs, multimedia messages, or instant messaging. So what's the best way to kind of safeguard around this? What we would be doing is, if you're sending any electronic messages that could be deemed commercial in nature, so again, anything that's a reminder, so you're due for a routine pap smear, or here's a vaccination that you should have, or we run skin checks, we do travel medicine, all of that can be considered direct marketing. The key things you want to make sure that your practice has is, one, consent. Yeah, so only send these reminders if you have the patient's consent, and this consent can either be express consent or inferred consent. So express consent is what we usually would call an opt-in, when they go, yep, I know, I'm happy, I know that you're going to be contacting me about this, and I'm happy to go ahead. So for example, if you have that in your patient registration form. Or there's also inferred consent, which is really looking at, well, one, you were the person who collected this patient's information. So you as a clinic who collected this information. You didn't get this from, an advertising database of, people's names and phone numbers. That would be not correct, like not the right way of going about it, and not really following these principles. So you collected that patient's information, and there's a reasonable expectation for that patient to expect this kind of messages. Again, if it's something wildly unrelated to what a patient would expect that a clinic might contact them for, then you're technically breaching these principles, and you're now kind of breaching the Spam Act. But if it's something about, obviously, your health center, you're sending them information about health services, about health promotion stuff, or chronic disease management stuff, again, you would be using either that express consent or inferred consent. So that should be fine for most clinics. To identify, make sure that any information that you send them has very clear, or it's very clear to say who it's coming from, so that it's got the practice name and address and who to contact very clearly written on it. And the third thing, which is probably the biggest thing, is the ability to unsubscribe. So patients have to be able to opt out of these kind of reminder type messages. And that has to be clearly kind of made out to them, like it has to be clearly conveyed that they have the right to opt out from these reminder messages. Again, not if it's a recall or an abnormal test result or something like that. They can't opt out of when the doctor needs to see them for something critical, but they can opt out of any kind of health promotion reminder thing. So as long as you're meeting that criteria, then you should be fine. Like, there's nothing to worry about. You don't need to get patients to opt in or consent for every single type of communication or mode of communication that you might contact them in. Some clinics go to this level of detail. Great, if you've got the time and the forms and the capability to cater to this kind of level of care, then great. But it's not really, as long as we're letting them know that, look, we have a message, we have a reminder system, this is how we will use the reminder system, you can opt out. If you don't want to be part of it, then that's good enough. Okay? And lastly, I just wanted to very quickly talk about, in terms of training staff, privacy and confidentiality. As we've mentioned before, the key things are making sure that you make staff training on privacy and confidentiality part of your induction or your orientation process. Make sure that everyone signed their confidentiality agreement, because that kind of keeps them accountable to what you've taught them. Make sure that your privacy policy is very clear and transparent. Make sure that you have regular training refreshers as part of staff meetings. And if you're not running staff meetings, I can't urge you enough. This is running regular staff meetings is probably one of the most powerful things that any clinic can do. And I often see it, a lot of clinics kind of shy away from this, because yes, logistically it can be difficult, but there's so many things that can be addressed as part of regular staff meetings. So having training refreshers, of privacy, being able to discuss any slips or near misses that could be having an impact on privacy. Again, you can't really do this easily if you're not having regular staff meetings. And even if you can't get every single person in the practice to attend, doesn't matter if you're running them regularly enough, you know, and you have, obviously, you know, at the end you might have kind of dot points. It doesn't have to be full minutes, but even just dot points of what we've all agreed, then that goes a long way. In terms of resources, as part of the resources, I'll include a link to all the resources the RSCGP has created. So they've even got a sample template that you can customize. And again, the key here is make sure that you don't just customize it with your practice name. It's really about taking the time to reflect on what you're doing, how you're using these patients' information, and reflecting it here in a clear and accessible way. And as I mentioned, there's also going to be a specific training module just looking at developing your privacy policy, which is going to be released from next week. Again, we'll have the link as part of the resources.